Hello and welcome to Let's Talk About, a health podcast series brought to you by Tallaght University Hospital in partnership with the Adelaide Health Foundation. This is our second six-part podcast series, which you can find on the hospital YouTube channel, Facebook page, Apple Podcasts and Podbean. Each episode in the series will be targeted at anyone who wants to learn more about their brain, how they can mind it and how they can keep it healthy. Weighing in at approximately 3 pounds or 1.3 kilograms, the brain is a complex organ that is made up of soft tissue called grey matter and white matter, which contain neurons. Neurons are cells that send and receive information throughout our bodies in the form of electrical and chemical signals. Think of your brain as mission control for how you move, your senses, thought and reasoning, memory and vital functions such as your heart rate and breathing. Like everything else, your brain ages, but as you will learn in this series, there are lots of steps we can all take to help maintain a strong and healthy brain. The most important thing to remember is, it is never too early or too late to look after your brain health. Hello, my name is Paul McElwaine and I'm a consultant geriatrician at TUH and your podcast host. In this Let's Talk About podcast episode, we're going to talk about the brain and stroke, how and why they happen and what we can do to prevent them. I'm delighted to be joined by my colleague, Professor Rónán Collins, geriatrician and stroke physician. Díaghuit.
Díaghuit full.
Okay, Rónán, so I think it'd be important just for people listening just to get the basics really, if you could explain what exactly is a stroke and how you would know you were having a stroke.
So basically a stroke occurs when the blood supply to the brain is interrupted. That occurs by one of two main mechanisms, either a blood vessel, i.e. the pipe supplying the blood to the brain gets blocked, or it ruptures causing a bleed into the brain. That usually causes a set of symptoms which the patient experiences as a very sudden onset of either a loss of power, usually down one side of the body. There may be associated loss of sensation. There can be disturbance to speech, both in the ability to express yourself or understand speech, and there occasionally also is a disturbance of the vision on one side of the body. It sometimes is perceived that it's loss of vision in one eye, but you find if you close each eye that you will see that the vision may be lost in the left-hand side or the right-hand side of both eyes. So they would be the commonest symptoms: power loss, disturbance of cognition and speech, and disturbance of vision. There are other rare signs, or less common signs I should say, like the sudden onset of double vision may be a warning sign. The sudden onset of a very severe headache may be a warning sign. The sudden onset of disturbance in balance with vertigo may be a warning sign. But for general, the majority of strokes can be encapsulated with the acronym FAST: face, arm, speech, T standing for time. So if you experience any sudden loss of sensation or power down one side of your face, if you can't raise your arm and keep it up there in the horizontal, if you have a sudden disturbance of your speech, either in the expression, understanding, or your speech suddenly becomes slurred, any of those may be a warning sign if they occur suddenly that you're having a stroke. And the T means don't waste time, ring for an ambulance, ring 999.
And sometimes people talk about having had a stroke or a mini stroke. Is there any difference between the two?
Well, I suppose it's in terms of severity. So occasionally, in about 15% of cases, people who have a stroke have a warning sign that precedes it. That warning sign is usually similar symptoms of power loss, sudden disturbance in speech. There may be loss of vision on one eye only in this occasion as well. And that very often can suggest that there's an underlying mechanism which is about to lead to a bigger stroke. The mini stroke, or the concept of a mini stroke, or transient ischemic attack, some people may have heard that term, TIA, transient ischemic attack. It really is just a matter of duration, that the symptoms have resolved pretty quickly. But it's important to recognize it as a risk factor because it has the same urgency to it. I mean, you don't know that your symptoms are going to resolve. So once you get those symptoms, don't be hanging around to see how they're going to resolve. Ring an ambulance and get into hospital. If it resolves, no one's going to be given out to you that you came to seek an opinion. We want to prevent stroke, so every TIA that presents, we see as an opportunity to prevent a bigger health problem for you and, of course, for us in the hospital.
Who would we commonly see would get a stroke? What sort of things do we look at as ways of reducing the risk of someone having a stroke?
So the first thing to say is, I suppose, there's many different causes of a stroke, because the mechanisms by which your pipe might block or which your pipe might rupture in your brain are many. But I suppose it's true to say that age in itself, as we get older, increases our risk. And if you think of the brain as plumbing and pumping blood through the pipework, as we get older, our pipes get older. So they're more likely to clog up, they're more likely to rupture as we get older. So age itself is an important risk factor. The things then that specifically accelerate that damage to the blood vessels to your brain are high blood pressure, diabetes, heart conditions, including importantly an irregular heart rhythm called atrial fibrillation, having high cholesterol. And then there are specific lifestyle factors that feed into that. Physical inactivity, having a higher than ideal body weight, smoking very importantly, excess alcohol intake, and more importantly for some younger people who might be listening, illicit drug use, and in particular cocaine can damage the vessels to your brain. And so there are many different factors. Many of them are age-related in the sense that if you have high blood pressure for 15, 20 years, it's more likely to cause damage by the time you reach a greater age. And so they are the risk factors. And I suppose then you ask me, well, what can I do to prevent stroke? Well, the first thing to say is that it's never too late to change your ways. So what lifestyle things have you control over? Please stop smoking for your own sake. Reduce your alcohol level. Alcohol is enjoyable. I enjoy a glass of wine myself, but reduce it to sensible levels. Be physically active and be conscious, not in an excessive way, but in a general way of what your ideal body weight should be, and to try and stay close to that, either through increased physical exercise or through manipulating your diet a little bit. So there are some of the things you've got direct control over. The other thing you have indirect control over, and I say that because you should know what your blood pressure is. You can go to your doctor and find out what your blood pressure is. You can ask your doctor, particularly again if there's a family history, is there any chance I have diabetes? And as you get older, your doctor will increasingly check your pulse to make sure that there's no irregularity, you don't have underlying atrial fibrillation. So the direct things you can do, the lifestyle measures, which are very important. And they're important not because it's just to reduce your risk of stroke, but all those measures I alluded to will reduce your risk of heart disease, will reduce your risk of kidney disease, will reduce your risk of dementia, and even visual loss going forward. And if I was to pick one of those things that I would check with my doctor, particularly when we're younger, in our kind of maybe 40s, that is the real time to check what is my blood pressure like. Because blood pressure is very common. It rises as we get older, but the earlier we control it, the less likelihood it's going to cause damage to our eyes, to our brain, to our heart, to our kidneys.
I think it's an important point that a lot of the risk factors for stroke are very treatable. Stopping smoking obviously is an obvious one, but blood pressure can be well controlled throughout life if picked up.
Absolutely, and I think also, increasingly, a lot of medicine is high tech and can be expensive, and I realise as well that healthcare costs are not inappreciable to many people. But blood pressure is one of the things that we can actually detect, we can treat effectively, and it doesn't cost the world.
Yeah. And I think in a sort of general vein of the podcast that we're or the messages that we're trying to put out there, you would probably commonly see the after effects of the stroke and how it impacts people's daily lives. I think particularly, I don't know what your experience has been or how common you find the cognitive impact, memory being possibly one of those cognitive impacts, but how commonly do you see that after stroke, and what sort of things would you do as a physician to try and help people regain their independence?
Yeah, so the first thing to say is I think our outcomes in general after stroke have been improving over the last 10 years because of better treatments of acute stroke. Also, some of the preventative measures we institute mean that even if a person has a stroke, it's less likely to be as severe as it would have been if they hadn't been on that preventative treatment. I say that because the cognitive difficulties and maybe some of the emotional difficulties after stroke are very much linked to stroke severity. And so driving stroke severity down means that these things are becoming less common. That being said, there are two broad categories. One are the cognitive difficulties. The cognitive difficulties range in terms of studies, but anywhere up to 40% of people report cognitive difficulties after stroke. If you put fatigue in as a kind of an allied symptom, that goes up to as high as 70 to 80% of people after a stroke. However, the cognitive difficulties are wide-ranging. So some people are left with word-finding difficulty. That's a cognitive difficulty. Some people may be left with difficulties in doing tasks, in sequencing how to do a task, like things that we take for granted, as someone described to me recently, opening a window, and as they were experiencing the stroke, their brain just couldn't figure out how to open the window. And sometimes people can be left with, if you like, simple everyday task solving difficulties known as apraxia. Stroke sometimes, of course, affects memory as well, and short-term memory, and people have difficulty with concentration. So they are all cognitive symptoms, and we do see these, I suppose, commonly in about 15 to 20% of people after stroke. Generally, if you've been treated in an acute stroke unit, your team will and should have in place a program of rehabilitation, which would extend into a period of follow-up in your home, very often with early supported discharge and regular review. Because sometimes the progress we make in hospital in terms of rehabilitation, once people go home and back to their lives, they may experience, I found new problems, or just because we got better, they may also experience a little dip in that function again that needs a further period of rehabilitation. So I suppose what I'm saying is that it's important that you keep in contact with your stroke team after discharge for your initial appointments, and then subsequently with your own doctor, who will be communicating with the stroke team to say, listen, we're not quite where we should be maybe, or we're having some further problems, can we have a further review? That's the cognitive side of things. The other aspect of things I would say are the emotional difficulties. Depression is very common after stroke. Again, up to 40% of people in some reported studies experience significant depression. The onset of that may not be immediately just after the stroke, as you might assume. It may not hit you for several weeks or even months afterwards, when your body's adrenaline surge, which has protected you during the acute medical episode, begins to subside, and you suddenly go, it really hits you. The impact of what has happened to you hits you. Again, some of that depression may be a reaction to some physical impairments you may be left with. Some of it may be just the sheer life event that has happened to you. And of course, there are other things around having an event like a stroke, such as affecting relationships, or your own self-perception of my new self after a stroke may impact on how you feel emotionally. And then, of course, many people experience fatigue after stroke, which is allied to mood abnormalities. Again, the good news is that much of that can be treated effectively through exercise, which is a very important modality for improving both well-being and, I suppose, energy levels after a stroke, but also through aspects of psychological support and even medication support. And certainly some of the SSRI medications can be very useful after stroke in restoring that sense of well-being and energy after stroke. So I suppose the approach to that is multifactorial. So that's some of the medical models about how we approach it. But what I would say to people in general is that in terms of dealing with cognitive difficulties and in dealing with emotional difficulties, there's two very important things I have noticed. People who are most successful in adapting to this have very good social networks and supports, are open with their supports about the nature of problems. So I think a frank and open discussion with your formal supports within your own family or wider relationships, being open with what's happening, the way you're feeling, and also socialization. Getting back into socialization as much as possible also tends to kind of improve kind of people's ability to adapt to the new situation. So they are very important. And of course, I realize as I say that, of course, that many people may not have such family supports. So we do have a very good stroke support network set up, stroke survivors groups. There's almost a stroke support group in every community now, certainly within most of the metropolitan areas and a lot of rural areas also. And in addition to that, the Irish Heart Foundation run a very helpful stroke support line. And I think if you are experiencing difficulties, certainly reach out to them. They'd very much welcome you making contact. And of course, your own doctor, again, can link you back into stroke services locally.
Okay. And we come near to the end of the podcast, but perhaps just to ask you, we often ask our guests if you had one top tip or takeaway message that you would like to get out to people listening at home, what would it be in regards to stroke and brain health?
I think with regard to stroke and brain health, the two top tips are know your blood pressure and maintain a good social network. It's always useful.
Okay. Well, Gura Míle Maithfid, Rónán. I think that was a really helpful discussion. Hope our listeners enjoyed it. I would reiterate, do learn your blood pressure. It's not difficult, it's not painful. Just get it checked with your own doctor. And I think that was a very important point around mental health and openness about talking about your worries or concerns. Stroke can be a life-changing event, so don't suffer in silence. So thank you. In the next episode, we'll be talking about brain health and its importance in our senses.